Weissig is getting his lighting set, and he should be ready to go.
Yes, unfortunately, I do not have a nice background you guys have. I only have my plain office here.
I couldn't get the background to work for me.
Okay, fine. Let me share the screen. Do you see my screen?
Yes.
You see the presentation mode?
Yes, we do.
Okay. Well, I also would like to thank the organizers for giving me the chance to give a talk at this extremely interesting symposium. I will talk about where we are in the development of new drugs for mitochondrial diseases, and I will focus on Leigh syndrome, of course. As of 2 years ago, there have been a total of 232 ongoing or completed clinical trials aimed at the therapy of mitochondrial diseases. 21% of these trials included new molecules, so-called new chemical entities, and I will get back to this. 12% of these trials included FDA-approved drug, repurposed drugs, that means drugs which have been approved for other indications but not for mitochondrial diseases. 18% include nutritional interventions. A large variety of available supplements are being tested. And approximately half of these 242 ongoing or completed clinical trials involved the testing of new diagnostic tools, and also very important, we investigated the compatibility of widely used general drugs with patients suffering from mitochondrial diseases. Now, I have updated this and focused on Leigh syndrome, and this compiled a few months ago. A total of 16 ongoing or completed clinical trials specifically targeted at the treatment of Leigh syndrome. Half of these trials, that means 8 trials, involve new molecules, new chemical entities. 12.5% again include old drugs, and 37.5% include observational studies, registries, as we just heard, and the investigation of tissue samples. I will exclusively focus now on these 8 trials which involve new chemical entities, NCEs. What are NCEs? These are new molecules with new chemical structure. Most important, we have never been FDA approved before for any other applications. And here are these 8 trials. Now, please don't get lost in this busy slide. I will draw your attention to 3 major aspects. If you look at the drugs, the new chemical entities which are being investigated, you see we have one which is called EPI 743, and that's actually developed by PTC Therapeutics, which we just listened to from Matthew Klein. And the other one is KH176, being developed by Condrion. That means only 2 new experimental drugs are currently being tested specifically for the treatment of Leigh symptoms. Another one at the bottom has been withdrawn, so I didn't consider this. So that's the first conclusion, first aspect, only 2 new experimental drugs. The second one is both drugs are being currently tested in clinical trials, which are still recruiting. This one for phase 2, started in 2021, is still recruiting. And these 2, for phase 2 and even phase 3, done by PTC Therapeutics, they are also recruiting. That's the aspect number 2. Now, the third aspect is, what are these drugs? Both drugs are so-called redox active molecules, antioxidants. Does it make sense to develop antioxidants for the treatment of mitochondrial diseases? Yes, of course. We all know that mitochondrial dysfunction in one way or the other leads to the elevation of reactive oxygen or reactive nitrogen species or free radicals. And we also do know that free radicals, or I will from now on only call them ROS, but ROS involves also reactive nitrogen species. They cause mitochondrial DNA damage, and we can cause a whole bunch of other clinical symptoms, neurodegenerative diseases. Alzheimer is being associated with elevated ROS levels, diabetes, metabolic disorders, chronic inflammation, and more. Subsequently, currently, actually, 8 redox-active NCEs, antioxidants, are being tested in clinical trials for therapy of all mitochondrial diseases. And among them, EP743 and KH176. So first conclusion is a lot of new drugs which are being tested for the treatment of mitochondrial diseases are antioxidants. And for that reason, I would like to say a little bit more about antioxidants, because there are promises, limitations, and challenges. Let's talk first about the promises of using antioxidants for the therapy of mitochondrial diseases. Antioxidants can ameliorate symptoms and slow down the progress of disease. As a result, they can and will improve the quality of living. However, antioxidants cannot cure the disease. Further, all of the 8 redox-active compounds, which are just introduced, also could be tested for the treatment of Leigh disease. Likewise, these 2 drugs which are being tested for Leigh disease are currently being tested for the treatment of other mitochondrial diseases. Like KH176 is also tested for MELAS and for Leber's hereditary optic neuropathy, and EP743 also for Leber's hereditary optic neuropathy, Person syndrome, Friedreich ataxia, and others. What are the challenges in trying to develop antioxidants for the treatment of mitochondrial diseases, and in general also for all other diseases? There are many different reactive oxygen or reactive nitrogen species. There are superoxide radical anions, hydrogen peroxide, hydroxy radicals, and many more. That's number 1. Many different ROSs. Second, these RONS are selective in their reactions with biological molecules. And surprisingly, we leave most of them undamaged. Essentially, and I have highlighted this in red, the real culprits are hydroxy radicals. They attack everything. And now in the context of drug development, more important is there is no universal best antioxidant. That means each antioxidant reacts with different reactive oxygen or nitrogen species at different rates in different locations and protects different molecular targets. So developing one antioxidant to treat it all is almost seemingly impossible. Another big challenge, and that's also more my personal view, if I may offer this, and I think is still generally a little bit underappreciated. We have to look at 3 different levels of reactive oxygen nitrogen species. There are 3 different intercellular levels. The first one is the physiologic level, and this might be surprising to many. We actually need reactive oxygen nitrogen species. We need free radicals. They are serving as messengers. They are widely responsible for the regulation of the entire metabolism. These are the so-called physiologic levels. Even if we increase the levels of reactive oxygen nitrogen species, for example, in response to hypoxia, in ischemia reperfusion injury, hypoxia, ROS level goes up. And the purpose is these ROS, reactive oxygen species, we actually trigger the launch of protective pathways. Now, only if we further increase the level of reactive oxygen species, we have a pathologic excess, and only at this level, again, which is being produced by an unregulated overproduction of reactive oxygen or nitrogen species, at this level, we get oxidative damage. So now the real challenge is, imagine a normal, healthy human being just has elevated levels of reactive oxygen species in order to trigger protective pathways. And now we kill all these reactive oxygen species by putting antioxidants in the body. Well, maybe it's not so a good idea. So the real challenge is antioxidants should only target the excess of reactive oxygen and nitrogen species. And how to do this? This is a huge challenge. In the second part of my talk, I would give a brief summary of clinical trial outcomes related to these two drugs, which are being tested for the treatment of Leigh disease. And now I do not read the title of the clinical trial. I don't read the aim of a clinical trial. I also would like to pay attention to the outcome regarding the efficiency, safety of the drug, in this case, KH176. So the results. First, this drug is well tolerated at certain doses, and the pharmacokinetic profile is supportive for twice daily dosing. So it's safe at certain doses. Only at high doses, this drug can cause clinically relevant changes in the cardiac electrophysiology. So at a certain dose, it's safe. Another clinical trial involving the same drug, results, again, the dose was well tolerated and appeared as safe. No serious treatment emergent adverse events have been observed. However, also no significant improvements in gait parameters, for example, or other outcome measures have been observed, yet generally a positive effect on alertness and mood has been recorded. And again, I do not read the exact title and the exact aim of a clinical trial. I hope that works this way. The next three ones are dealing with EPI 743. Results, 12 patients treated with this drug have survived, 2 patients died. Out of the 12 survivors, 11 demonstrated clinical improvements, with 3 showing partial relapse. And in general, this drug has modified the disease progression in more than 90% of the patients, which is, of course, a very, very good outcome. Another one, same drug. In this trial, 4 patients demonstrated arrest of a disease progression and reversal of visual loss. 2 patients exhibited a total recovery, no adverse effects. Also very good results. And finally, another for EPI 743. It was again demonstrated to be safe and well tolerated, and at treatment for 24 months, a statistically significant improvement in neurological function and disease progression has been recorded. Now, in my final slide, I would like to show where we are with development of new drugs. These are all, I compiled this approximately 2 years ago. These are all new chemical entities. Okay, these are drugs which have not been approved by the FDA for treatment of any diseases, let alone mitochondrial diseases. And it shows where we are in terms of phase 1, phase 2, and phase 3. So you can see, as of 2 years ago, none of them has been FDA approved yet. Now, I'm updating this graph now, which I made 2.5 years ago, based on the fact, as I introduced, that EPI 743 is currently, since February 2022, recruiting for phase 3. So I upgrade this and give EPI 743 and push forward. However, as you can see, the front runner is still an approach which uses gene therapy for the treatment of Leber's hereditary optic neuropathy. Well, thank you very much for your attention.